Dr. Andrea Araujo is a registered psychologist based in Vancouver and is board certified in neurofeedback. She brings a strong background in psychological assessment and neurotherapy, using tools like qEEG brain mapping and neurotherapy to support cognitive and mental health. And her work spans everything from ADHD to anxiety, memory loss, concussion, peak performance. She offers both in-person and remote neurofeedback training, and she's deeply committed to integrating innovative brain-based therapies into her work, and we're excited to have her share her expertise today. Today, she'll be sharing the findings from a case study on the use of transcranial photobiomodulation to support the recovery after a mild traumatic brain injury. The case highlights meaningful improvements in anxiety, sleep, and executive function over a 7-month period, and results are supported by qEEG data and psychometric assessments. Thank you so much, Dr. Andrea.
So some personal experience with photobiomodulation. I first started with using the Neuronic helmet after a personal experience having a concussion. So one of my colleagues had shared this with me, and it actually helped me quite a bit. And this was before I'd used this ever in my practice. So this was an important time in my life. It was about 2 years ago, and I was just about to prepare for some big exams, professional exams. And so I was quite worried that all of a sudden I'd experienced a memory loss, and quite acute. And after 2 months of using the helmet, particularly using the focus protocols and the glow, my memory had actually completely returned, and it was even better than before. So that was a really positive experience for me, and I purchased the helmet at that time. And I thought, okay, I really need to get fluent in this and maybe even start to introduce this in my own practice. So today I am using photobiomodulation in my practice. I do use it with neurofeedback training clients, and it is something that I use starting out before the session. And, as we know that the near infrared light energy drives the greatest mitochondrial response of the entire electromagnetic spectrum. There are, from research studies such as the one published in the Journal of Neurosurgery in 2000, we know that mitochondria are compromised during traumatic brain injury, and interventions towards the enhancement of mitochondrial functions are necessary to regain proper brain functioning. I also do at-home training for clients. So clients that purchase the helmet, and after they have a qEEG, then they are using clinical protocols with me, and sometimes customized protocols that they get with me. And this client is one of these clients that I'm going to be presenting today, who started out as an ICBC case. So this client, and I'll get to her in just a second, but this client is someone that had the motor vehicle accident in 2019. And she came to me primarily suffering from anxiety, and she was unable to work. And so the helmet was seen as something that she could use to help her with the anxiety and executive function, improve her sleep. But before we get to that, I just wanted to share a couple of research studies here that you may be familiar with, but that support the use of photobiomodulation for neurodegenerative diseases and traumatic brain injury. The first one here, according to NICER, the putative mechanism by which photobiostimulation may lead to significant improvements in traumatic brain injury is via the increase in mitochondrial ATP production, which could enhance cellular respiration, oxygenation, and function. And it is known in cells whose mitochondria are compromised that nitric oxide inhibits cytochrome C oxidase. Therefore, in response to rad or near infrared photons, nitric oxide is released and diffuses outside the cell wall, leading to local vasodilation and increased blood flow. Additionally, transcranial photobiomodulation demonstrated anti-inflammatory effects in different brain pathologies brought about by inflammation. And so it is plausible that the mechanism by which PBM improves cerebral blood flow and delivery of oxygen to the brain parenchyma is through enhancement of nitric oxide production. The next study, which I'd like to also just read off here, which is from last year in the International Journal of Molecular Science, is a review study, but it does show, again, that PBM can regulate several signal transduction and metabolic pathways dependent on neuronal survival. For example, it can improve the survival of neurons, promote neurogenesis, reduce cerebral inflammatory reaction, enhance cerebral blood flow, and maintain mitochondrial homeostasis so as to improve the response of neurons to cell damage in the process of neurodegenerative disease progression. Okay, so in the case study, this explores the impact of transcranial photobiomodulation on cognitive function, emotional regulation, and psychometric outcomes in a 40-year-old female client with post-concussion syndrome following a mild traumatic brain injury resulting from a 2019 motor vehicle accident. And the work I'm doing with her is ongoing, but in this case study today, we're looking at a 7-month intervention period using the Neuradiant 1070, where she demonstrated significant improvement in anxiety, sleep, and executive functioning, supported by pre and post intervention qEEG findings, brain maps, and health questionnaires. So it's just to give a little bit of background on her. She started when she was 39. She's currently 40, so the post is, brain maps are when she was 40. And as I mentioned, she suffered a motor vehicle accident in July 2019, which resulted in a mild TBI and post-concussion syndrome symptoms. She had been a very successful pharmaceutical salesperson. I believe she worked in that industry for 12 years. High performer and very intelligent woman, but due to her injury, she had to stop working. Hasn't worked for the last 6 years as a result. She describes herself as an outgoing individual whose extroversion intensified after becoming mother to her now 4-year-old son. But after the accident, she found socializing difficult due to visual and auditory sensitivities. She also claimed that she'd always been a bit anxious, but her anxiety increased substantially after the accident. And that's why she had come for counseling therapy. Her other main concerns surround her sensory sensitivities, sleep difficulties, pain, and cognitive difficulties. Okay, so in this case too, I received the neuropsychological assessment, and her anxiety was so high that the doctor said, we want to rule out OCD, and we also think that maybe this client, because of her extreme reactions, might even be borderline. So one of the first things I did was to rule that out, and we did the Yale Brown OCD scale, and she did not meet criteria for OCD. And just to note that she also had no history of suicidal ideation. There was no other trauma other than the motor vehicle accident or abuse in this case. Okay, so some of the presenting concerns and symptoms, a little more detail here. She definitely had the sensitivity to light and sound. Social anxiety was extreme, impaired executive functioning, especially with planning and multitasking. She had chronic headaches and brain fog. Her memory deficits, including trouble recalling names, was profound. Symptoms resembling seasonal affective disorder. So really having a hard time with her mood, especially when it was dark out. She had physical pain in her back, shoulder, and neck. And the impact was from the front. She was driving, and it was on the passenger side. Okay, just so you know, when we look at the brain maps. And then her sleep disturbances. She had an onset of insomnia due to the concussion as well. So she was a lighter sleeper, and she also had a significant startle response during sleep initiation, meaning that when she was starting to fall asleep, her body would shake her awake and wouldn't let her fully enter into relaxation. She was also unable to travel. For 6 years, she was unable to drive more than 20 to 40 minutes, depending on the circumstance. So bringing her son to school even was very difficult. Being a passenger in a vehicle was difficult. She was unable to fly, leave the country, even take SkyTrain to go somewhere. It was really challenging for her. She's also not taking any medication, and she would use magnesium in the evening to help her with her sleep. And then she also was taking ongoing a supplement, the Gym Quick supplement, which has ashwagandha in it, and that was just to produce an adaptogenic response to help her with stress. And so she did take that throughout the time we were together, and she continues to take that because she finds that beneficial. Okay, so what was the intervention? What did we do? So we used the Neuradiant 1070, and again, we started in April last year to November, 2 sessions daily. And a third session was added only during episodes of severe anxiety, and that was really just using the same clinical protocol 1, which I'll share with you in just a moment. I'd like to add to this that she does continue to use the Neuronic today, and what I'm going to show you today is only from this 7-month segment, and I'll explain why. Even though I know it's June now, and I did want to get another brain map to show you her response since. I do have an updated protocol that I've given her since this last one, but the reason why we didn't do that is because she went into arbitration with ICBC and was settling her claim. And this was a very extensively anxiety-producing time for her. And so we were doing a lot of counseling, and I did actually change the settings on her clinical protocol back to the original one, which I'll share with you in just a moment. So, she finished the settlement process last week. Yes, and there is a qEEG data, and I'm about to show that. So we have not done a follow-up Q, and I'm hoping to present that in the future. So additional support, just so you know what we were doing in the cognitive behavioral therapy sessions. We were using some visualization, guided audio meditation, progressive muscle relaxation training, belly breathing, box breathing training, submerging her face in cold water, which is a technique that is known as evidence-based technique to reduce anxiety when it's submerged for 30 seconds, and it can lower the temperature of the face by 2 degrees. Going for walks, journaling, yoga nidra, which is a type of yogic sleep. And then also we use the basic exercise from this book, Accessing the Healing Power of the Vagus Nerve by Dr. Stanley Rosenberg, which is a very helpful technique to increase the parasympathetic response. So baseline assessments were done, as I mentioned, April and in November. We also did health questionnaires pre and post. In her GAD-7 questionnaire, which is a generalized anxiety disorder questionnaire, she had received a baseline score of 15, which is severe anxiety. And then in the PHQ-9, she had a baseline score of 15, which is moderately severe depression. There was no nutritional analysis. I am a registered psychologist in BC, so I don't do those, but I do take a holistic approach, and she has not worked with functional nutritionist, unfortunately, but she's a very healthy individual and does eat very cleanly. So here are the first brain maps. So I'm showing this in Joule, and then I also have the NeuroGuide, and I use Joule because this is the report I use to give to my clients. It's helpful. It uses the qEEG database, and I do collect and do training in BrainMaster Avatar, and this software works really nicely with that. We did not do any neurofeedback training. Please note that this was only used with the helmet. And as you can see here on the left, there is quite a lot of delta, and TBI, language processing problems and short-term memory problems are often the case when we have delta, and also particularly in the temporal lobe. Globally, she doesn't have the frontal delta, which is great, but we often see emotional processing issues and ADHD type symptoms when we have delta. And as you can see, it's present in the eyes open as well on the right. The alpha, we see EEG slowing in temporal lobes on the left here, and the eyes closed. And it's often associated with concussion, since head injuries, regardless of the site of impact, often involve that scraping of the temporal lobes along the inner part of the bony middle fossa. And problems with temporal lobe slowing are one of the most common type of EEG abnormality, especially the depth of this lobe, the amygdala and the hippocampus. And there can be cerebral blood flow issues. As we were mentioning earlier in the research there, it shows that the mild anxiety can increase that, but severe anxiety actually reduces cerebral blood flow, and that can be a problem. So, and then I think the most prominent thing we can see here is the beta is excessive and global. And, if someone is exceptionally anxious and tense, an excessively high frequency of beta brainwaves are usually present in different parts of the brain. And, this person, our client X, has a very hot cingulate, showing that it's quite overactive and causing problems such as OCD and ADHD type symptoms. So, the anterior cingulate, it's the hub of the emotional regulation and limbic system control. So things like mental flexibility, cooperation, attention, transitions can be a problem here. And she definitely had issues with that. In the next slide, we have the NeuroGuide map, brain maps in the eyes closed and eyes open. So again, we can see the delta and theta showing up, as well as the high beta. And the reason I wanted to show in NeuroGuide is not just to show this database, because there are slight differences between, and alpha is not showing up as much in this one, but I wanted to show the coherence. And, there isn't a lot of hypo or hyper. There's some there on the left, but the phase lag is, definitely present. And when there's a deficit, those signals are just not arriving in good time. And so your brain functioning is going to be impaired. And then, as we know already, reduced coherence is present in the frontal and parietal regions, which indicates reduced connectivity, and that is often related to the reduced speed and efficiency of information processing, which this client definitely had. Okay, this was a 19-channel brain map. It did show, with the Loretta 3-dimensional, the source analysis, it showed that this was consistent with the surface EEG. And, an anterior cingulate, again, was highlighted here in terms of being abnormal, including the rest of it we see here on the surface. So there's definitely a good reason for her to have these types of OCD and highly anxious symptoms that she was presenting with.
West Center has a question right now. I don't know if you want to, are you okay answering right now or wait to the end?
Please go ahead, Brain and Behavior Associate.
Yeah, so what I'm seeing here is advanced phase, not actually a phase lag, except in theta between F7 and those frontal regions. So it's mainly advanced phase, not phase lag. So it looks like the EEG is slowed between the one on the left and the one on the right, unless I'm missing something.
There is some advanced here in the theta. I do see that, but I mean, by and large, in the delta and here, the blue, I believe that means a deficiency.
So the blue would be low lag or high speed. The red would be high delays or phase lag.
Phase lag, yeah.
Yes.
Okay.
So the lag increased over in the right most over the left, but you have an overall the phase is going from advanced to more normal between the two.
Right. Thank you for that. And yeah, and so the difference between these two maps, this is a pre, and again, the one on the right is the eyes open. So that may be affecting things a little bit there. Thank you for your question. And now, so what we found here, and just to reiterate, in both eyes closed and eyes open maps show mild excessive slow wave activity and significant excessive beta activity. And the slowing persists between both conditions, indicating potential inflammation. Some slowing over the temporal regions can indicate problems with short-term memory, which the client did note. And global delta increases indicate problems with processing emotions and give rise to ADHD-like symptoms. A faster alpha is observed in the temporal region in eyes closed and more frontally in eyes open, and this can also contribute to symptoms of anxiety and pain, as well as attentional difficulties. And then, as I mentioned, excessive beta indicates that the brain is running too quickly in both the eyes closed and eyes open, and points to anxiety and OCD symptoms, particularly with the anterior cingulate, which the client does report. Okay, so we've seen the pre. Now let's look at what was done for the protocol. So clinical protocol 1, which was the one that, when I was saying that earlier, when she would be able to use this to reduce anxiety and, use as a third session, this is the protocol we had. And basically, we just started her off 5 minutes at 8 hertz, 75% intensity, and then off for 5 minutes just to rest, and then back on for 5 minutes. And so this was quite helpful for her. She was instructed to use this at any time of the day that she was feeling anxiety. And then after 1 month, she was instructed to add either the PEACE protocol, which is 9 minutes at 10 hertz, 25% intensity, or GLOW. Okay, and so then we also had a second protocol, which was used, that I asked her to use with eyes open. And this protocol was similar to the first, but the front and the sides were increased to 10 hertz to see how the client tolerated a slightly faster frequency frontally, yet slower than what her eyes open brain map demonstrated. And this was, again, to reduce anxiety, but not to bring it down too slow, because she was having those executive function issues. We also, and I'm going to go through the notes and just so you can see how she progressed, but we did add the focus to help her improve her executive functioning during the day, but that was not a helpful protocol for her, okay? That actually increased her anxiety, and so we did not, even though we tried it, we did not persist with that one. Okay, and then some notes here. So she started in April, and then after 1 month, she had already improved in sleep quality, okay? So she told me at this time she was ready to add the GLOW and or the PEACE protocols. She said she felt ready, and she did do that after a month. It was spotty though, it was kind of on and off. By May 25th, she noted that her OCD tendencies had improved and she was getting much better sleep. And she was actually able to reduce the amount of coffee she was drinking. And she only was drinking coffee in the morning, and she had 1 cup every morning. She did not notice any improvements in her anxiety, however, as small things were still inducing a startle response. And so, main points here is that she had improved sleep and reduction of OCD tendencies. Okay, and then eyes closed protocol here. We revised to help her. So we had started at 8 hertz at 75% intensity, then all off, and then back on for 5 minutes at 6 hertz, and then for 5 minutes at 4 hertz. Okay. And the rationale for the updated protocol was to help the client relax more at night, slowing the frequencies of the brain to produce or promote calming of her nervous system and encourage sleep. Okay, and this is actually in the research for insomnia treatment, a 6 hertz session 1 hour before bed, followed by the literature of 3 hertz, half an hour before bedtime shows promise for improving sleep quality via rhythm entrainment. And so she did actually notice those results. Okay, for the eyes open, as mentioned, we had all on we kept the same one for the eyes open, and we introduced the glow at the end for 5 minutes at 100%. And she also, as I said, was using focus, but then was stopped. Okay, so her timeline of events here, we're in June, so this is about 2 months after using the Neuradiant. Her anxiety had been reduced and her energy was lasting longer through the day. She actually told me that due to her improvements, she was feeling healed enough now that she was getting bored. She was ready for the next level. And so that was a really positive thing to hear. She had improvements in her brain fog. She was motivated to try new things. She had increased self-awareness. She was using the Neuradiant 1070 every morning and about half the time in the afternoon and evening. And occasionally an extra set was an extra session with preset glow was used midday, and 75%, it was really just to give a bit of more of a boost. There was honestly, that was just an experimental choice on my behalf. I wanted to see how she would do with it, and she actually did quite well. On June 18th, the main points here were reduced anxiety, increased energy, her improvements were in brain fog, motivation to try new things, and self-awareness. And she was, like I said, she was moving away from a victim mentality. At this time, because she was going to be traveling in the summer, I believe it was in July or August, she had 2 trips she was going to take by plane. And so this is when we started to introduce the exposure therapy. And she asked me, she wouldn't be able to take the helmet. So she wanted something to take with her. And so I was using this device called the Bella Bee, which is a PEMF device, wearing it on the back of her brain. And so we used 10 hertz protocol, again, that mid-range alpha, to help her. And she did find that very helpful. So here in July, after 2.5 months, she reported that she was dreamy again, and she had unlocked a new level of confidence. She was able to practice gratitudes towards her situation and that she felt they could be worse. She reported that she felt that the Neuradiant twice a day had greatly improved her sleep and her sensory sensitivities, and that the Bella Bee had helped with her mood. Then July 23rd, she had said that she now felt that the new protocol was helping with her learning. So when she was reading, she said that she would previously go to the same spot repeatedly, not be able to, embrace a concept, and she had now found this easier. And a really big bonus here was that she had started to take public transit, which was a milestone for her. I remember the day when we met, and she was just so radiant. She was so happy that she had been able to take public transit, and that was a SkyTrain, and she had not been able to do that for like 5 or more years beforehand. Just a really, really big bonus to this. And I didn't even know she was going to do that, so she did that on her own. Okay, so main points here were improved learning and can take public transportation. She also said here that her nervous system and her executive function was going in the right direction. She was feeling more like herself, and that she wasn't drinking coffee in the morning either. We were able to wean her off of that. So she was really, really starting to be able to reframe a lot of these sensations and experience them differently. Anxiety being reframed as excitement, and also her life planning too. She was leaving room now, making space in her schedule for unexpected things to happen so that she wasn't packing her schedule. She just really was trying to make her life a little more spacious so that she wasn't go, go, go. And this was also beneficial for her. Then September, this is the last one for the timeline of events here. September, she reported that she had become more hypervigilant at night. This was after her trip. And, even though she was sustaining previous improvements, this was just before, this was in the period before the ICBC mediation for her case. And, I think that this was part of what was happening here. And we did end up changing the protocol slightly after her preparation for this. And then in November, this was right after we did the brain map that I'm about to show you. She reported that her anxiety during waking hours had improved, but she felt she could get fatigued without coffee. So there were further improvements to anxiety, but she was feeling a bit fatigued. So the reassessment, and another thing that was happening in this time between September and November was she had a lot of IMEs, which are basically medical examinations. She had 6, I believe, and they're usually about 3 hours long or more. Very, very challenging for her, with neuropsychologists, psychiatrists, and other doctors as well. So that was a very stressful time for her. Okay, and let's go to some of the improvements that she noticed overall, that she had noticeable improvements in her OCD symptoms. Her compulsions were less severe, and her compulsions were really around cleaning. She could wear clothes more than once, as long as she hasn't been in a public restroom. I didn't mention this before, but that was what her OCD symptoms were mostly around. She demonstrated greater mental flexibility and reduced anxiety around contamination. Her energy levels had also stabilized, and she had completely eliminated coffee over the past month. She didn't have as many highs or lows or jitteriness. Her mood had improved, and also with decreased irritability and increased overall happiness. Occasionally, she said sometimes she would stay up really late, and she thought she could still function the next day. Okay, and then some challenges. She did notice that she could only tolerate driving for 10 minutes at a time and preferred her husband to drive. Her social interactions with high-energy individuals still felt overwhelming. Decision-making remained difficult, making tasks like packing and organizing. She also went through a major move in this time too, moved her house. So again, we were doing a lot of counseling around that. Anticipating future commitments was still a source of stress, and with concerns around unexpected delays or feeling stuck. And then to help manage stressors, we had been working again with the breathing and some other of those tools that I had mentioned earlier. Her post-brain map, and again, work in progress, but from eyes closed from pre to post in Joule, you can see that there was a significant reduction of the delta, theta, and alpha frequencies, and that is also present in the eyes open. I will show that in a moment. And all the slow frequencies were eliminated in the eyes closed and eyes open, and even some of the beta frequencies were reduced. Okay, I'm going to just continue here. You can come back to that if needed. So the excess beta had also been reduced. Again, not as much as the delta and theta, but you can see here in the eyes closed, there was that reduction, and that did help her significantly. In the absolute, you can see here, there was that reduction in beta as well. So I think that correlates well with her reduction in OCD and anxiety symptoms. And just a summary of that: in eyes closed, the decreased high beta can result. So the client was using the protocols twice a day. So decreased high beta can result in decreased anxiety, which she reported. She stated that ruminating thoughts and compulsions were reduced, and her ability to fall asleep had improved. And she experiences less intermittent sleep, and overall quality of sleep has improved. Again, she was dreaming, which was really nice, and the stabilization of delta and high beta could indicate improved efficiency of energy, which may relate to her decreased need for coffee. Okay, and then in the eyes open, you can see here the pre and post in Joule. Again, using qEEG database, there was that reduction and elimination of the delta and theta, and reduction in the beta. You can see particularly in the lower in beta 1 here, in beta 2, there is that reduction, eyes open. Still, hot cingulate. Yes, it's still there. This isn't, game over for her. She's not done. She's still using the helmet and the protocols. But I was really happy to see this, and this is why I thought this would be helpful to present. This is just one client that's using this, but I do have some others that are also having some great improvements in memory. And let's see here, there is some increased hypocoherence here. We can see a little bit, but overall we do see that there is that reduction in the slow frequencies and in the fast frequencies in the NeuroGuide database as well. Okay, in the brain maps. So, okay, that was a qEEG comparison slide, and that one didn't show up in in the notes here. But a summary here for the eyes open changes is just a regulation of slow and fast frequencies, representing a more energy efficient presentation and greater emotional regulation and ability to manage her OCD tendencies. And I think that for her was a significant improvement in her life quality. Like regulation of posterior beta gave her increased tolerance for sensory input, and also produced less rumination and anxiety symptoms, particularly related to her Ph.D. symptoms from the accident. In terms of the health questionnaires, these are reversed. So GAD-7 was first before. We had 15 severe anxiety and went down to 7, which is none to mild anxiety. And then her PHQ-9, which was for depressive symptoms, went from 15 to 10. So there was still some moderate depression. And, if you think about her life, she's still not able to return to work. She does depend completely on her husband to support her. She used to be a very high functioning individual. So, this does play into it. Her quality of life has been reduced in that sense that she isn't able to work, and she is raising a small child. So it does impact her. Okay, so again, here, this is some of the potential mechanisms. I don't know if we want to get into this, but this is just a little bit of more of the research here that the PBM is shown to improve, cognitive and psychological effects, and by increasing ATP production, PBM helps the tissue reduce inflammation, increase circulation, promote neurogenesis, and reduce cell death. PBM has widespread effects from boosting mood to enhancing cognitive functioning, which we have seen here in this study. Many of the improvements found with this client can also be found in research studies. PBM can help reduce anxiety symptoms, and the scale also outlines symptoms such as anxious mood, insomnia, and troubles concentrating, that this client, her initials are IIT, also reported improved, and which can also be reflected in the health questionnaire scores and qEEG findings. And also improvement in sleep is backed up by the research on photobiomodulation as well, and it argues that PBM can support lymphatic drainage during sleep. Okay, and then some limitations of this study, obviously, could be user compliance reliability. This client I really do believe she used the helmet twice a day. She was religious about this, okay? And this does play into her OCD as well. Like, she really wanted this to work, and it did work for her. So, the second limitation, of course, is that this is a case study. This is only one participant. It's really hard to generalize this. But, over time, these results have borne out. And even today, she is, she's done the mediation now, and she is just feeling fantastic, like really, really great. We did lower her clinical protocol 1 to be from the 10 hertz in the front to be all 8 hertz again, because she was experiencing a bit of an increase in some anxiety symptoms. But that has worked for her. And overall, she's just really thrilled, and she will continue to use the helmet. Okay, so conclusions here. This case study not only furthers research findings showing the efficacy of PBM for brain injuries, but also provides a promise for improvements in chronic head injuries rather than just acute ones. This is obviously a chronic head injury with this client. And based on these findings, the next steps might include a reassessment, which we will be doing, and then working to reduce the high beta and increase posterior and alpha would continue to reduce anxiety and hypervigilance and help her improve sleep. All right, that is my presentation. Thank you so much, and open for questions.
All right, John McCroot.
Hi, guys. Been a long time. Andrea, thank you so much. What a great presentation, and really adding to the foundations of research and all of this. So thank you for that. It's hard to, as a practitioner, I know you have the same challenge. Why wasn't you doing neurofeedback? It's going to, these kind of confounding factors and variables are going to mess up a research presentation like this, because now you're dealing with multiple items. So I appreciate the discrete quality of what you did here. Having said that, I brought up the nutritional component only in that I encourage anybody who's using these devices or in this health and wellness field to really find partnerships in your communities to get some of this nutritional platform analysis done. We're just discovering here, and have for the last several years, that the quality of their nutritional platform directly affects the outcomes from whatever intervention you happen to be doing, whether it's neurofeedback or a tPBM, et cetera, et cetera. There's a wonderful product called the NutriEval from Genova. I don't have any financial interest in it. It's a terrific, can be ordered by a primary care physician. They don't normally order it because it's expensive and probably not reimbursed by insurance, but you can actually get this test. It's about $500. It'll point you to neuroinflammatory markers, which is going to interfere with the success of any of these interventions, including photobiomodulation. So we really have to try to rule out or support, in some sense, someone's elevating that platform so that the tPBM is going to work better. Let's just say it that way. Whatever results you're getting, they're going to be better if you can reduce their inflammation, especially in a TBI case. It's almost goes without saying. Delighted she gave up coffee. Dear God, I saw that in the thing. I was like, oh my God, that's the worst possible thing she should be doing for herself. She's got all this beta, and she wonders why she doesn't sleep, et cetera, et cetera. I understand she took 1 cup in the morning. I know, but people can be extremely sensitive to this, and the duration of caffeine in the system is way longer than people think. Oh, I stopped drinking coffee at 7 o'clock at night. It's fine. No, it isn't. Yeah. You know, we all know this as professionals, but you know, the common parlance is in the culture. No, I'm fine. So delighted she gave that up. That was not making matters better for her. HRV training, 100%. That's one of the primary tools that she should be using at home. And if she has some OCD elements, she'll probably be compliant. Most of my clients are not. They hate using it. Teaching people the understanding of breathing and just I mean, we use the HeartMath product, and I tell you, it's an entryway. You should be able to do this on your own. You don't have to attach a clip to your ear. Learning how to breathe is vital. What else did I want to talk about? Oh, just for psychotherapists in this community, there's a thing out there called DBR, deep brain reorienting, which for anybody, a couple of people are nodding. It's not well known yet. Sabrin Fisher speaks about this endlessly. So just tune into any of her recent podcasts or videos, and you'll find out more about DBR. If you can find somebody in your community, frankly, it can be done on Zoom. That's the interesting part about it, and it's very short duration. So somebody with trauma history, I would assume inclusive of traumatic brain injury from an accident, but certainly in terms of developmental trauma, that's one of the tools that should be brought in, and it would help, I think, address some of the issues that this particular person was having. DBR might be an interesting choice. Did this person ever do a sleep study? Was a question I had.
No, and that was something. So I want to point out a lot of things you're mentioning here. I do have answers to, but the sleep study was one that we did not do, and it was recommended for her. So she lived. The reason why we didn't even do the neuro and we introduced the helmet and then the Bella Bee was because she lives about an hour and a half away from me.
Oh, okay.
So she's a remote client.
Yeah, got it.
Able to do that type of work, and then so we were meeting over Zoom. So we were doing the breath work, and yes, I am familiar with the work with Sabrin Fisher and the deep brain reorienting. I'm not a practitioner, but I have attended some of her seminars on it. But this client doesn't have a history of trauma other than the motor vehicle accident.
Right.
Yeah,
I got you. In terms of sleep study, there's a company, again, I have no financial interest in this. There's a company out there called Empower Sleep. It's a 30-day sleep study. It's a really long one, tons of data. It's a ring, easy to wear. I'm just getting going with this, so I'm not an expert in it, but it came to me from a sleep physician that I know in San Francisco. And the guy who runs it, Dr. Chopra, is also a board certified sleep physician, in addition to 4 or 5 other things that he's certified in. But point is, Empower Sleep, anybody can look it up. Anybody can refer to them, psychologist, any wellness practitioner can refer clients to them. I think it's $500 for 30 days. Okay. And the data is reviewed by Harvard-trained sleep physicians. They really know what they're doing. Might be, especially for a remote client, simple to do. They ship the thing right to your house. You do the data, they send it back, gets the analysis. It might give some clues as to she's got ongoing issues that are still there, especially in terms of her sleep. There's something going on that's been unexplored at this point. So from the nutritional or sleep study, maybe there's some clues in there as to the next steps. I'll stop talking now. Thank you so much, though. Great presentation, Andrea. Thank you.
You're so welcome. Thank you very much. Those are great suggestions. And yes, this is definitely only one avenue for the treatment. And so far, it has been very successful in just this alone, but you are right. There does need to be more done. And a sleep study, that was one of the first things I asked her about, but she had said no. So I will look into that recommendation there. That sounds really interesting and probably something she could do. Any other questions or comments?
Oh, we've got one. Let me see. Oh, no, John just popped in Empower Sleep.
Well, I just put Empower Sleep in the chat, but the question, the other question I had was, and I think Dr. Center is on the line. What was I going to say? Vagus nerve stimulation might be useful for her as well.
Nerve stimulation, right? Yes, I do that as well. But again, that would have to be in person. So yeah, she did use the Bella B, and she did purchase that. So that's an at-home use consumer grade PEMF product. It's a very simple PMF in a band, and you can customize that. So she is using that at times and finds that very helpful for sleep and mood. But that's the only stimulation other than the helmet that she's using.
I had one question for you, Dr. Andrea. I noticed that you used the tPBM with both eyes open and eyes closed, and many people just stick with eyes open, or they don't tell the client one way or the other. Can you just share a bit about why you chose to do that, and if you've noticed any difference between people who only do eyes open versus both eyes closed and eyes open?
Sure, that's a good question. With this client, she had a lot of trouble just relaxing with her eyes closed. I think there was, this relates to the symptoms from PTSD from the motor vehicle accident. And so I think she felt safer with her eyes open. And so getting into that relaxation state with her eyes closed, even just for 5 minutes at a time, and then, increasing it to 10 minutes at a time, that was actually an important part of her therapy. And for her to be able to do the breathing while she had the helmet on and to reduce the frequencies and start to have that relaxation response with her eyes closed. So that was my rationale behind it.
Thank you. Fascinating. Okay. Well, if there are no other questions, thank you again, Dr. Andrea, for sharing such a compelling case. It was just what really stood out was just how meaningful it was to have clear improvements years after the injury. And Patricia Jo Ryan has a question. So before I finish.
I hit the button improperly, but nonetheless, I still probably could have some comments to say. Number one, I'm beginning to believe that we have experienced multiple minor traumas throughout our life from the time we're little, because the sensory experience is what the child, the infant has when they're born. And the brain doesn't know how to figure out at that time, because of its primitive state, what this means when they startle. And so for some reason or another, it just makes sense to me that there are multiple traumas that get accumulated over time. And then when something big happens, like, any kind of brain injury or anything like that, it just doubles, or geometrically doubles the difficulty. And so mainly because part of, I have an Aura ring, so I now measure stress. And I have these things that go up in stress, and I'm saying, I don't feel any stress. So I know it's adaptive, or it's adapted. And so what else is going on? So my brain is still working to figure out what may be happening. That may be part of that. This is what the brain accumulates in times over experience. What I've always used in working with any kind of accident client is systematic desensitization, which I think is basic and primary. If you don't get that somewhat modified, then you're not going to get other things. But I understand what you did in terms of that was very nice, because you didn't have any confounding interventions, that was really quite remarkable. And I think the PBM is quite remarkable. But in any case, so that's my comments.
Thank you.
Thank you.
Yeah,
Thank
and
you.
that's absolutely true. You know, she did note that she had some anxiety before as well, although she had not stated any trauma, like traumas, big traumas.
Right.
You know, she is a new mom too, so she does have a child in the background that she's taking care of, so that could have played into it as well. And also, you know, just the fact that her life changed so dramatically from being a high achieving professional to all of a sudden only being able to stay at home.
Right.
And yeah, so there's a lot of factors there.
Right. And the DVR is wonderful. I took the training and it's wonderful. I haven't used it a lot, but that doesn't alter the fact that I think that what is also remarkable is the research stuff that he supports his work with.
Right.
It's just remarkable. And so I'm very appreciative of that.
Yeah, I haven't taken the training, but I've just taken the workshop, and it does look like something
Excellent.
in the future. Yeah, thank you.
You're welcome.
And please encourage your client to just let go of the idea of multitasking. It's not real.
Yeah, exactly. Yeah, thank you very much.
Well, thank you. And thank you again, Dr. Andrea. And I just want to let everyone know that there is a case study that's been co-authored by Dr. Andrea and Nicole Gregg. It's been written as a blog and it's available on our website. I'm going to put that link in the chat here. And as a quick reminder, our next meeting will be July 3rd. And we'll be joined by Dr. Darcy for a session on, I believe it's PBM effects on cognitive brain neurophysiology with real-world applications in performance concussion and cognitive aging. And we hope to see you there. But thank you so much for joining us today. Thank you, Dr. Andrea. This was really enlightening, helpful.
Fantastic. Thank you all so much. Take good care.